This is episode 1, and it says time for the nurse to take the patient's vitals using AIDIT. And I'm the patient, Leah is the nurse, and Megan is the instructor.
Come in.
Hi, Miss Scott. How are you doing today?
I'm good. How are you?
I'm great. My name is Leah Fulcher, and I'm going to be your student nurse from MC, and this is my nursing instructor, Miss Megan Bull.
Okay.
We're here to take your vital signs today. It's probably going to take about 5 minutes.
Okay, that's fine.
Okay, let's get this over here. We're going to start off with your pulse rate. So you're going to keep your hand like this.
Okay.
Jessica demonstrated a therapeutic communication technique called cold spot. Cold spot stands for character, onset, location, duration, severity, pattern, and effects.
10%. 10%.
Okay, Miss Scott, everything is looking good. Now we're going to take your systolic pressure. Do you know what your blood pressure normally is?
120/80.
Okay, that's great.
Leah, what method did you use for taking the pulse?
When you take the pulse,
All I'm doing,
you feel the radial pulse, and you count it for 30 seconds and multiply by 2. And that's your beats per minute.
No.
Did you also count her respirations?
I did. I got 16.
Alright, so
Just gonna blow this up.
your boyfriend cheating on you.
And they're going to let this rest for just a second.
Okay. What did you get for the estimated systolic?
I got 120.
So when you air it back up, where are you going to
I'm
inflate
gonna
it to?
air it up at 150 millimeters of mercury. Let's go. Okay. Just going to take this.
So y'all ready to do like a run now? Or
Yeah.
y'all want to practice?
Oh, okay. So what's been troubling you today, Miss Jansen?
Well, my boyfriend with 3 years cheating on me with my best friend.
Oh, really? How'd you meet him?
Well, we met in the hallway at school.
Okay, great. How old are you?
13.
Okay, great. How long have y'all been together?
We broke up.
Oh, you broke up because of the rock. Dang it, that's going right back on track. You're supposed to oh my gosh.
You have to be like, you
I
cut her off.
got 1 and 2 over 70. That's really
Cut
good.
her off.
You have to be like,
Okay.
All right. Thank you very much. Is there anything we can do before we leave?
No, I'm good. Thank you.
Thank you.
Make sure her call light's in range, Leah.
Okay,
Really?
yes, ma'am. Your call light is going to be right here in case you need us again.
Okay, thanks.
Or kind of like you are not paying attention to her, like you input like tiny foot,
Was that better?
like you're really just not.
This is episode 2, and it is Roleplay 1 Therapeutic Communication Technique using Solar. Tierney is the nurse, and Megan is the patient.
Okay, Ms. Bolton, we're going to start off today by doing a little health history on you. What kind of medications are you taking?
Well, I've had a lot of heart problems, so the doctor put me on some kind of medication named digoxin or something. I don't know. What is that for? I don't even know why I'm taking that.
I'm not sure exactly why he's prescribed it to you, but I will find out and come back and let you know.
Alright.
Okay. Thank you for your honesty.
Alright.
Do we?
Be the easiest.
This is episode 3, and we are role-playing 1 Therapeutic Communication Technique using Solar. I'm the nurse, and Leah is the patient.
Okay, so Miss Fulcher, what brings you in today? What can I help and assist you with?
I've been having a lot of trouble eating.
Okay, so you're having difficulties with your eating habits. Can you tell me more about that?
Well, I really am not wanting to eat very much.
Okay, so you're not eating as much as you would like or you think is healthy.
No, I only eat once a day now, usually.
Okay, so you only eat 1 meal a day.
Yes. and usually it's like bad things like chips or snacks and stuff like that.
So your eating habits are not as healthy as you'd like them to be.
Right.
Okay, well, I'm going to go talk to Dr. Bolton, and he's going to come in, and we're going to discuss, and we're going to find out what we can do for you.
Okay.
Okay, thank you for your
Thank
time.
you.
The call button's right here in case you need me.
Okay, thank you.
This is episode 4, and it is role play 1 non-therapeutic communication technique. Megan is the nurse, and Tierney is the patient.
So Tierney, are you divorced, single, widowed, married?
I'm single.
You're single. Didn't you have a boyfriend last time you came in?
Yeah, I did, but things didn't really work out, so now, yeah.
What happened with you and him? He was kind of cute.
It was a bunch of things, a bunch of factors played in, and I just decided that I didn't want to do it anymore.
What kind of factors? Did he cheat on you?
Kind of. It's a lot of stuff. It's a lot of stuff.
Well, Well, I mean, I might want to date him later, so I need to know if he cheated on you.
Well, I don't really know about all that, but yeah.
Oh, I guess I need to be.
This is episode 5, and we are going to identify at least 4 basic principles related to the nurse-patient communication process.
Hi, my name is Leah Fulcher. I'm here to talk to you today about AIDIT, which is you acknowledge the patient when you first walk in, you introduce yourself, you tell them what you're there for and what the duration is, which be duration and explanation, and then when you leave the patient, you tell them thank you. So that's what it is. When you do this is when you initially meet the patient, or if you walk into another patient's room, that's somebody else. Okay, the reason we do AIDIT is to establish that rapport with the patient. We do not want them to feel uncomfortable in any way, so this is how we can kind of help them to know what's going on, and then we actually help ourselves by doing that because we explain everything in detail.
Okay.
A therapeutic relationship is a helping relationship aimed at realizing mutually returned goals and establishing a personal relationship with the client while making sure you still be professional. Some techniques of therapeutic communication is giving information, giving broad openings, silence, clarifying, focusing, restating and rephrasing, reflecting, honesty, making observations, and exploring.
One basic communication technique is SOLAR, and it is in mnemonic that stands for S squarely, O open posture, L leaning in, E is for eye contact, and R is relaxing. We use SOLAR when talking to any patient that we come in contact with. It is to show the patient that we are interested in the conversation and that we're willing to pay attention and listen to what they have to say, and we seem relaxed and involved in the conversation. An example of this would be is if I was sitting down talking to somebody that deals with depression. To show them that I'm actively listening and involved and interested in what they have to say, I would use the mnemonic SOLAR to show this for an example.
The last therapeutic communication principle that we're going to talk about is non-therapeutic communication, which I'm demonstrating now, and I demonstrated a minute ago in the video. My arms are crossed, I'm slouched and leaning back in my chair, and I look fairly disinterested with what I'm doing and what I'm listening to. As I did in the video in the example earlier, which was probing and inappropriate behavior, I was asking the client about things that I had no business knowing and that were not health related in any way and that I wasn't going to document. So I was pretty much just prying into the patient's life. That's one of the examples of non-therapeutic communication. There are several more examples, like giving advice, telling a patient everything's going to be okay because you don't know if it's going to be okay or not, and it sounds like you're not really interested in the patient's problem and you're just trying to brush it off. And some more examples of non-therapeutic communication would be condemning the patient, telling them something was bad, or telling them something was good. You would never want to use non-therapeutic communication because it tears down the professionalism and the rapport that you're trying to build as a nurse, and it's uncomfortable to the patient.